Hello. Are you serious right now?
Like I'm Drizzy, cause I'm about to hit my I need a lot, Louis Gucci Prada. See young niggas fall, can't be you, but that's my ass. And it's like they switch up to provide it to a robber. Proof is in the pudding, get it popping like a chopper. I'm not doing this just to fucking waste time. Got a lady catch, turning nickels into dimes. Not from the same mom, got the same bloodline. So what I been doing, I'ma do it every time.
Hello, I'm coming back to you. This would be, actually, I need to count on the calendar. Hold on. It's between 4 and 5 weeks post-op, but let me count to be very accurate. So, let's see. 1, 2, 3, 4, 5. This is actually 5 weeks, 2 days, or a day, post-op. Now, I don't know what it is that I can actually cover in this video. I just know, like, a lot of times people just fall off and you never know what ended up happening or what they look like later. So this is 5 weeks post-op. In my opinion, I'm still having a lot of swelling. They say majority of swelling is usually gone by 6 weeks. I'm kind of not happy. Well, yeah, kind of not happy because to me, I'm more swollen and still swelling more than I would like to. I mean, it's not that bad, but, you know, I'm semi-like things to be perfect, but, you know, it just is what it is. So I'd say most important thing is, like I say, showing what I have now. Okay, now you can look here in my body and you see how here I have dents. It goes in right here. Now, part of my BBL, like the doctor is supposed to fill these out, which I know he did inject here, but as you can see, it really didn't take. So I personally would like to get this filled in a different procedure. So I need this filled in all the way. I just want it to be like full hips right here and not this dent in the middle. And then the other thing, okay, so that's that. Then here's my BBL portion, where I mean my, you know, and for me, okay, for me, this is a lot of bum. This is a lot of bum for me. My butt never really was like this. But that's that part. Now, I did also have the bra back roll liposuction, and I can tell, like, it's swollen. That's the thing, it's swollen. I still have bruises. This is one of the entry marks right here from the procedure. But still, there's just like bruising. There's, besides these entry marks, there are just like black marks still on my skin from the actual liposuction, like here. This is another entry mark up here. But like these are actual bruises. I'm assuming these are gonna go away with time. This still remains very like super sore. This part of my back is super sore. My stomach is numb. I cannot feel, okay, I can feel this. Now down the middle, I can't feel that as much. I can feel this fine, but right here in the front, I cannot feel anything. This is completely numb. I don't feel anything. And this is my actual, like I say, incision right here. It seems to be getting darker and darker over time, which I've been using the bio oil, but I've also had scar away strips, which I haven't started using because I kind of wanted for this to be fully no more scabs. And just in certain areas, I can still feel scabs. Because when I put like a part of a scar away strip where there was a scab, it kind of like made the scab ooey gooey and soft again. So I didn't want that. So I'm just waiting to like have no scab to this at all, which in certain areas, like this is still scab. Still feels a little bit scab here and here. There's a bunch of scab right here. And then I'll put the scar away, which should help that as well. But yeah, this is my scar. Okay. And, what else? I don't know what else. Like I said, I don't know what else I can cover for this. One thing that I can tell you, I do not know why. Maybe I've just eaten a lot. I don't know. But like I said, the day of my surgery, I was 167. When I came out of my surgery, I was like 173 and tons of swelling. I am so much smaller than I was before, and I'm still 173. So whatever that means. And like I said, I'm not focusing so much on, I'm not really worried about scale numbers. It's just, how do I look to myself overall? Do I like my look? Now in here, it's almost like as soon as when I come out my faja, this just swells right back up. I don't know. Come out of my faja right away. It's kind of more small and to my skin where I can directly feel my muscle. But then once I'm out of it, which right now I'm out of it because I'm washing it and I just got a tub. So what I do is I get in a tub, go put it in the wash. Then I'll be without it till it goes through the wash cycle and the dry cycle. But that's pretty much where I'm at. I don't know. I don't know if there's anything else. Like I say, ask questions. Anything that you want to know, definitely ask. You know, a lot of people go and say, oh, but I have you know, what I don't know, have a round 2. And a lot of people are like, oh, I'm so completely satisfied with, and my doctor knows that. Okay, I don't feel that way. And I don't feel it's that my doctor didn't know what to do. My doctor told me he used all the fat of the areas. So I had my planks, I had my bra roll, my love handle area liposuction, and he put in he said he used all the fat that he had that was possible to. He didn't have any more fat to use. So it's not that he did anything wrong. It's just the areas that I chose was not enough to give me the complete look that I wanted, which like I said, I wanted fuller hips in here. And actually I want more projection. He put like a lot of in here. I mean, like, it used to be super flat in here, but, so he really filled in. I showed him like here and here, and that's exactly, you know, what he did, but he could have went for more fuller. He definitely did in here because I remember it was like super swollen right here. I could just feel and tell the way it was that he did inject here. It just didn't stay. And honestly, it stayed more on this side than this side. I don't know if you can tell in this video, but this one is more out than this one. This one is real sunk in. Anyway, so yes, I do want another procedure. Yes, I will. I'm sure I'll go back to the same provider. I'm just trying to figure out where else to get fat from. My arms, like I said, super fat, but I don't know if this is enough fat to still give me the projection and the hips that I'm looking for. But the only thing I can think of is like here. And honestly, I did not want to take anything from my legs. My legs are super thick. And I like them that way. I really didn't want to take anything from them, but I might not have a choice but to kind of come down on them some. But like I said, when I cross that bridge, we'll cross that bridge when I get to it. But other than that, I am happy with my results. I can definitely tell the difference, you know, with how I look. Yes, I have this enormous scar. However, it's okay with me because no one will see this scar. I mean, like, you know, I would not wear anything anyway that would be showing that, or even like, honestly, I don't even like bikini bottoms. If I could get a bikini bottom that was like a thong, I would wear that. But I just never liked how like full-size panties look on my butt. I didn't like it prior to the surgery, and I've tried it on in the store, and I still don't like how it looks on my particular butt. So if I had a thong, like bottom, you know, bikini bottom, I would probably wear that. But I don't think I'd be comfortable wearing that in public. But what I will do is wear shorts. Like I like boy shorts for bottoms as a bathing suit, and then with the top like this. That works for me for swimming or whatever. But that's my update. Like I said, I didn't have much to say. I just wanted to, you know, like I say, at least say, yeah, I'm still here. I'm still on this journey. It's kind of stabilized, I guess, between week 4 and 5. There's not much difference. Like from week 3 to week 4, it was like huge swelling went down, like a lot of changes happening. Nothing really happening now. I just wish this swelling, and it's so weird because on the bottom here, I can completely feel underneath this. I completely have total feeling. Well, on this side I do. This one, yeah, I have total feeling underneath my incision. However, right above my incision, I can't feel anything, you know? And I just wish this swelling would go down. But like I said, my disappointment, and like I said, that is not less swollen, is the fact that they say, oh, most swelling goes down like at the 6-week mark, and then over a year span of time, it should like kind of like fully subside. But my thing is like, to me, this is still more swelling than I would like to have for the next year. But I still look heads and shoulders as far as my body shape and whatnot. I still love it way more than what I had before. But I mean, that's all that I have for you. If you have any questions, like I said, I will come back to you, and probably yeah, I don't know what my next video is going to say or be about. This is just to let you know, yes, I'm still on this journey. Yes, you know, this is how I feel about where I'm at in this journey so far. I'm happy with everything. I'm glad that I did it. And like I say, I'm just enjoying my journey. But I will talk to you guys later. And you guys have, you know, a great day, afternoon, whatever time you're watching this. Just enjoy the rest of the time. Thank you. Talk to you later. Bye.